People in crisis need to be heard. However, unfortunately, they are not always heard. There are a number of common limitations in mental health crisis care that can interfere with the client's recovery process. Let me summarize a few of these limitations. The client may be separated from their support network. The circumstances that led to the crisis may be ignored. Therapists may have a clinical gaze. Strengths and coping skills of the client may be ignored. A diagnosis may be made quite quickly. Open dialogue operates fundamentally differently. It is a way of working with people experiencing a mental health crisis that is based on a person and family-centered approach. It is also a holistic approach that takes individual circumstances as well as strengths into account. A key difference between open dialogue and standard care is that open dialogue uses network meetings. These meetings are attended by the client, two mental health practitioners, a member of the client's family or social network, and during these collaborative meetings, all voices are heard. Open dialogue was originally developed in Finland during the 1980s by Jaakko Saikola, Brigitta Lakare, and Jukka Aaltonen. It has since been implemented in mental health services in other Scandinavian countries, in the US, the UK, and Australia. In 2003, one of the first Finnish research studies evaluating open dialogue found that at 2-year follow-up, clients who had engaged in open dialogue had less residual psychotic symptoms, shorter hospital stays, fewer relapses, and less need for medication. Similarly, one of the most recent research studies evaluating open dialogue found that over a 19-year period, clients who had engaged in open dialogue had shorter hospital stays, less need for disability allowance, and less need for medication than those in standard care. Currently, a large-scale research project on peer-supported open dialogue is underway in the UK's National Health Service. The research is both quantitative, looking at clinical outcomes, as well as qualitative, looking at the experience of service users, carers, and staff involved in open dialogue. Open dialogue is based on 7 principles, which are immediate help, a social network perspective, flexibility, responsibility, psychological continuity, tolerance of uncertainty, and dialogical practice. Immediate help means that the client is seen within 24 hours of first contact. The reason for this is that the person can feel safe quickly. In addition, if possible, network meetings are arranged at the person's home to see the client in context. The second principle, a social network perspective, means that a network meeting is attended by the client, at least 2 mental health professionals, members of the client's family or social network, and possibly a peer support worker. The third principle, flexibility and mobility, means that treatment is adapted to the client's needs. Examples of flexibility are that the frequency of meetings, as well as the therapies that are selected, are based on the client's needs. The fourth principle, responsibility, is expressed through, for example, the first staff member who was contacted also organizing the first network meeting. In terms of treatment, all team members assume responsibility following an open discussion about therapeutic choices. The fifth principle, psychological continuity, posits that at least one mental health practitioner continues throughout the entire process, may that be a few weeks or many months. Ideally, all mental health practitioners would continue throughout a client's treatment. The sixth principle, tolerance of uncertainty, means not having preconceived ideas and not arriving at a quick diagnosis, but instead providing a safe environment for all members of the network team. The seventh principle, dialogue, assures that everyone attending the network meeting contributes, that all voices at the meeting are heard, and that all voices count. Dialogue creates a new understanding of the client's behavior and symptoms. How does open dialogue fit in with Australia's mental health care services? Open dialogue aligns with Australia's goal of recovery-oriented mental health care, as outlined in Australia's mental health plans and frameworks over the past 10 years. Recovery-oriented mental health care includes that the lived experience and insights of clients and their families are taken into account, that strengths are emphasised, and that psychological support is provided by services in partnership with consumer organisations and community groups. In Australia, an open dialogue approach has been implemented at a number of private mental health services. These include St Vincent's Private Hospital in Sydney, Lou's Place, which is a women's refuge in Sydney, and also at Alfred Health in Melbourne. The open dialogue approach has also been implemented at two government mental health services, the Illawarra Shoalhaven Local Health District and the Nepean Blue Mountains Local Health District. Both services cover multiple sites in the Greater Sydney region.